on. Good afternoon. This is Eileen Doherty with the Colorado Gerontological Society, and I'd like to welcome you to our presentation this afternoon called Bringing Services to Your Home. It's part of our Aging in Place series that we've been doing for the last couple of months, and we hope that you have found them valuable. Before we start talking this afternoon specifically about continuing to live in your own home and bringing services to you, I'd like to just, if you are not aware of it, if you are aware, to remind you of the Salute to Seniors. We are doing the Salute to Seniors again this year, August the 13th and 14th from 11 a.m. to 1 p.m. It will be done virtually. So you'll be able to watch it either on your smartphone, your tablet, your desktop, or your laptop. And we would invite you to sign up and register. You can register at www.senioranswers.org. And if you go to the link that says register for the program, you should be able to follow through. If you attended virtually last year, you will need to log in and then indicate that you are planning to register for this year's event. If you are new to the platform and you haven't joined us before, then you will need to create an account. We have a series of educational entertainment programs to bring to you this year, as well as some showcases. So we have some educational programs on climate change, on infrastructure kinds of things like roads and bridges and broadband. We have some educational or some programs, some jazz entertainment. We also have an Aztec Indian group that will be leading us through a spiritual Indian ritual. We have the Forney Museum doing a car show again. And then we have a resource expo with probably about 30 or 40 companies that are providing services to older adults. So we invite you again to register at senioranswers.org. If you have any questions or problems signing up, please feel free to give us a call. For this afternoon's presentation, then, I would like to talk a little bit about a number of different issues. The majority of this presentation is going to focus on home care, but there will be some additional information as we go through the presentation. So at this point in time in Colorado, there are two types of home health or home care agencies. There are Class A agencies and there are Class B agencies. A Class A and a Class B agency are both licensed by the health department. We're going to start out looking at a Class A. Class A is basically an agency that provides skilled services. Skilled services include things like nursing services, therapy services, infusion services, wound care. Medicare pays for most of the skilled care in home care, and Medicare has a very specific definition of what home care is. It has to be intermittent, and it usually is provided after either a hospital stay, a 3-day hospital stay, or a nursing home stay. It does require a physician's order. When you are looking at choosing a Class A or a skilled agency, usually you have a couple of choices. One is that if you are in original Medicare with or without a Medicare supplement or with Medicaid, you can choose any licensed home health agency in the state of Colorado that is willing to serve you in your home. The second type of agency is a Medicare Advantage, in which the Medicare Advantage or the HMO will have a list of home care agencies that they have contracted with, and you will be required to use one of those agencies. The services, again, so skilled nursing includes things like if you need to have a heart monitor checked, or your blood pressure or your diabetes, those kinds of things. Wound care, obviously, is what it says. If you have an open wound, especially a stage 3 or 4 wound, and you need that to be debrided and or the dressings to be changed, that is part of what is under skilled care. Physical, occupational, and speech therapy do have some limits in terms of how many visits Medicare will provide. And you do always have to be making progress and showing that you are getting better. And then once you plateau or get better, that is when services are discontinued. Under the Class A or Medicare rehab, there's also a very limited home health benefit, which can provide services for things like bathing and cooking. To qualify for skilled home care, you do have to be homebound. And Medicare's definition of homebound is that it has to be extremely difficult for you to leave your home, that you must be unable to basically go into the community without any kind of support or assistance. There are 2 exceptions. One is you can go to an adult day program, and you can go to religious services and still be considered homebound. You do have to have a physician's order, and it has to focus on rehab. So you have to focus on getting stronger. You have to focus on the wound healing. You have to focus, and they focus a lot on patient teaching. So they want you to basically know how to provide these services. The last thing that they really focus on a lot as well is patient safety. So they're not only going to be looking at your environment in terms of carpets and those kinds of things, but they're also going to focus on things like, can you get yourself in and out of the bathtub safely? Do you use your walker safely? Can you get in and out of bed? Are you giving yourself insulin correctly? So that's the kind of thing that they're going to look at, both from a patient safety as well as a patient teaching perspective. When you are looking to select a home health agency, it's important to do your due diligence. There's a couple of ways to do this. One of them is Medicare has a program of star ratings. You can figure out what the home care agency star rating is at medicare.gov. There are 2 areas that are evaluated by Medicare. One is patient care, and the other is patient survey ratings. So under patient care, they're really looking at how well does the agency both manage daily activities as well as do they treat various kinds of symptoms, such as pain, mobility, inability or ability to regain function. They're also looking at things like unplanned hospitalizations and what kind of care is being provided that will improve your situation. On the patient survey side, they go and they ask individuals, Medicare beneficiaries who are receiving services, how professional the staff were, whether or not they communicated with you as an individual, and what kind of care that was provided, as well as whether or not you would recommend that agency to family and friends. Another way that you can do due diligence is that all of these agencies are surveyed by the Colorado Department of Public Health. You can find a copy of their inspections, their citations, as well as their occurrences at the website called healthfacilities.info. This basically looks at the state rules as well as the federal rules that home care agencies are required to follow and how well they have done them. You can also see if there were any complaints filed by other users of their program. Colorado, we have about 200 licensed home care agencies that bill either Medicare or Medicare Advantage. Most of the referrals to this type of home care agency comes usually through either hospital discharge planners or nursing home social workers. As I said earlier, you can request any agency that you want, although some hospitals are partial, if you will, to certain agencies and may even have some type of either formal or informal working relationships. You can get information then at both medicare.gov as well as the healthfacilities.info website. The Colorado Gerontological Society also has a housing and home care locator service on our website, which you can use to collect information. You can also get referrals, if you will, from family, friends, and other agencies or community resources. In terms of the website that we have, our locator at seniораnswers.org, it is a searchable database of all of the licensed facilities that are in the health department's database. It is searchable then by either city or by zip code. And there is a screening questionnaire that you can fill out if you don't know what kind of service you need. So it could help you walk through that, which might be helpful. In addition to that, the database contains information on pricing, how these services get paid for, and what different types of services that the specific home care agency provides. So do they provide physical therapy? Do they provide infusion therapy? Do they provide wound care? We also have provided at that website links to medicare.gov and healthfacilities.info, so you can get that information in terms of their surveys. The second type of agency that we have licensed in the state of Colorado is a Class B license. This is often known in the world as non-skilled home care. And often that's what you see in terms of their advertising or promotions. They are too licensed by the health department. Again, there's many agencies licensed, so there's no need to use an agency that is not licensed. The kinds of services that the non-skilled agencies provide oftentimes include these kinds of things, but they can either not include all of this, or they can include things in addition to. But it's primarily things like bathing, meals, sitting services, reminding people that it's time to take your medications. They'll do some light cleaning, maybe walk the dog, etc. When you are choosing a Class B or a non-skilled agencies, basically there are few restrictions in terms of the kinds of services that are provided. They do often find themselves in a challenge with having enough staff to provide care. And the other thing is whether or not you can identify people who are able to travel to your home. So this is especially true for some of our rural partners, whether or not we have people who will actually be able to get to where you're going. We also, though, sometimes run into situations, for example, in the metro area, where somebody, say, will be living in Broomfield or in Parker, and the specific agency we're trying to work with does not either have staff or someone who is willing to travel to that area. You qualify for these services by paying privately. Sometimes long-term care insurance will pay as well. In this situation, there is an agreement between the client and the agency, and you then agree based on usually an hourly rate of the types of services and the number or frequency with which those services will be provided. Usually my experience is that the agency has like a list of services, and you can select whichever ones that you want, because I may need assistance with bathing, and food preparation, but I'm really not very ambulatory, so I may not need support with walking around the block, or I may not need sitting services. So it's a very a la carte menu usually. Now, the second way that you can qualify for services from a non-skilled agency is if you are on Medicaid. So you do have to meet the requirements for Medicaid, and I'm not going to go into the details about how to qualify for Medicaid. Anybody would like to put questions in the chat, or if there is interest or ask a question about how Medicaid works, I'm happy to field those questions. And if people want to know how the Home and Community-Based Services Program works, I'm very happy to provide a follow-up session in this series on exactly how you would qualify for home and community-based services through Medicaid. But very briefly, there are two ways that you have to qualify. One is you have to qualify functionally, which means that basically you need a nursing home level of care. You have to meet the assessment criteria in the 100.2 assessment form around things like protective oversight, eating, dressing, bathing, those kinds of services. And you can get that assessment done through the single entry point agency that serves your county. And when you get the PowerPoint, you can click on this link and it will take you to the agencies in Colorado that provide that service. The second way that you have to qualify to be able to get non-skilled care through Medicaid is you have to qualify financially. And you have to basically make less than 300% of poverty. If you're an individual, you have to have less than $2,000 in assets, or $130,000 if you're a couple, and you can apply through Colorado Peak. Again, to do your due diligence in terms of how do you know what kinds of services are being provided. These agencies are surveyed by the health department as well. So you can go to that website at healthfacilities.info. You can look at their inspections, the citations, the occurrences, and the complaints. The non-skilled home care agencies do not have any oversight by Medicare, so they are not going to have a star rating. However, if the agency is a Medicaid agency with home and community-based services, then you will find some information. You can find these non-skilled home care agencies. There are about 400 or more licensed in the state of Colorado. I will tell you that staffing is always an issue. Again, you can find a list of these at healthfacilities.info. You can use our website. It's the same site that we talked about a few minutes ago. You can search the internet, or you can look to family and friends or other agencies for referrals. There's a third type of agency that can also bring home care services into your home. These agencies are called home care placement agencies. They work very differently than the non-skilled Class B home care agencies. So a placement agency basically takes on the older adult as a client. They then serve as a broker or referral agency by creating a registry of staff or caregivers who have come to them and have said, I will provide bathing and meal preparation and transportation services to older adults or anyone in your system. So then the placement agency basically does a match between the older adult and the caregiver. And that is how they work. Now, this service is usually also paid for privately, but sometimes long-term care insurance will work as well. Then you as the older adult, you sign a contract with the caregiver. So the person who's going to be providing you services, you have some type of a contractor. That could be either a independent contractor as a 1099, or it could be a W-2 employee. Most of the time, it should be a W-2 employee. And the reason for that being because you are going to ask that individual to come to your house at a certain point in time. You are going to supervise them, and you are going to pay them a certain amount of money to provide services in a specific time frame. So although sometimes people try to make these caregivers 1099 employees, we have seen instances where they do not meet the Internal Revenue Service tests as a contract employee. So if you're looking at doing this type of service or using this type of a caregiver, I advise you to consider making them a W-2 employee. The contract then and the amount of money that you are going to pay the individual is negotiated individually between you and the employee. It is not a fee that is charged by the agency. These agencies are registered by the health department as well, but they're registered, they are not licensed. So you do not get quite the same amount of information about them, but they do or can be cited for complaints, occurrences, and citations as well that may occur while they are providing services. They are also required to have you sign a disclosure form that basically fully discloses that the home care placement agency is not the employer of the caregiver, but that you are the employer of the caregiver. You do pay an ongoing fee to the placement agency, and it's a relatively nominal fee, but that then allows them to continue to work with you if a caregiver doesn't show up. If you have any questions or anything that you want to follow up or pursue, then you are able to do that. Colorado, we have about 10 of these placement agencies, and as with the other two types of agencies, staffing is always a problem. Again, you can find them at the healthfacilities.info website. They're not in any way, shape, or form affiliated with or licensed by or certified by Medicare, so there's no information in the Medicare website. You can use our website, or you can get referrals from family and friends. The next thing I want to talk just a little bit about in terms of being able to stay in your own home is durable medical equipment. And as you can see on the right, durable medical equipment that is covered by Medicare with a physician's order is pretty vast. Wheelchairs, hospital beds, canes, crutches, kidney machines, ventilators, oxygen, mattresses, lifts, nebulizers. It's a pretty broad scope of services. Depending on the kind of health insurance you have, if you have original Medicare, some of these are available at an assignment and you pay nothing. Others will have a copay. If you have a Medicare Advantage, most of the time you will have the 20% copay. Durable medical equipment. Usually the way it works is Medicare will rent this to you. Specifically, the two to be aware of are wheelchairs and oxygen. Wheelchairs, you rent those for the first 13 months, even if Medicare pays for them. If you need to have them repaired, you do need to use a Medicare approved supplier, and they have to perform whatever repairs and maintenance are required, and that is usually done at no cost to you. In terms of oxygen equipment, you do have to pay the 20% copay each month. on the equipment. This is like the concentrator and the cannulas and those kinds of things. After 3 years, then you own the equipment, but then you pay the monthly copay. And then after 5 years, basically, they set you up so that you get new equipment. Oxygen, basically, again, if anything goes wrong with the supplies, the supplier has to fix it within the first 3 years. After that, if something goes wrong, they're still required to fix it, but you have to pay the 20% copay. So that's primarily the home care kinds of services that you can bring into your home. There are hospice services as well, but we don't cover those in this presentation this afternoon. Grocery delivery. So ordering online has become pretty commonplace, if you will, as part of the pandemic. And usually you can get front door delivery services with a fee. I have not had anybody in all the groceries that we have ordered and brought to people over the last year with the pandemic, not having them be able to be brought into the building and up to the individual's apartment. One caveat here is that if you order food from the grocery store and you want it delivered and you are on food stamps, you cannot use your food stamps. If you want to go and pick it up, you can use your food stamps. Most of the grocery stores at this point in time that we're involved with are offering same-day services and usually within 2 to 3 hours. Now, you do have to have a credit card because that's how you pay. Another feature that most of the grocery stores do offer is a text service. So if an item is out of stock, they can send you a text. You can then allow for or approve any type of a substitution. Another thing that people have become very, very used to, if you will, in terms of the the COVID-19 is no-touch shopping. One study that I read said that 62% of the consumers expect that they will continue to do no-touch shopping. What this is going to mean basically is less inventory in the stores. Someone told me over the weekend that they had gone into one of the retail stores and were very, very surprised at the low inventory. They expected to be a fully stocked business, and it was not. Many of the consumers are now starting to want to look at how they can experience a product online. And so in just a moment, we'll talk a little bit about how some of the virtual world is starting to respond to that. Most retailers are now also just having you put your credit card in their payment machines. This reduces, again, your touching anything that might contain germs. In the short term, this could be really good for things like the common cold and flu, because much of that is spread, if you will, by touching something that somebody else touched who has got a live virus or a bacteria. Customers are also very used to curbside pickup, and a lot of agencies are reporting that they're not seeing a huge decline in their curbside pickup or their online shopping orders as a result of the opening up of the city. So what does this mean for online shopping in the future, and what can we sort of start looking to? So there's a whole new term out here that I was not familiar with called C-commerce. And what C-commerce stands for is curation, content, convenience, and connections. So people who are starting to use online shopping in a more significant way are looking for additional ways that they can have a good user experience and at the same time get the goods and services that they want. So we expect that stores are going to continue to be hybrids, but there's also some technology that might be available. So for example, some of the new iPhones have a light detection and range sensor. And what that can do is that it can take a look at me and I can take a picture or whatever, and it would tell me, do I need a size 10? Do I need a size 12? Do I need a wide shoe or a narrow shoe? Another technology that I've seen mostly in the gaming world with my kids and grandkids is virtual reality or VR. And basically this is where consumers have in a video certain experience. So you put on these goggles or these glasses, and then it takes you basically through that travel experience or that sky experience or star or cosmic or whatever. And so when you start to think about this, what people are asking for or where this is going is that you, as the retail store outlet, will start providing various kinds of videos and tapes about their clothing line or their bedroom bath supplies or their dishes or whatever. And then you put on this headset and it will then show you what these look like and give you an opportunity to even look more closely sometimes at the kind of construction or whatever. Another futuristic thing is an in-store assistant, where basically you connect either through your iPhone or this VR technology or something with somebody in the store. And they take a computer, they go to that item, they may use a Zoom meeting, and they show you basically what is available in stock through your computer. And you say, I want the blue one and not the red one. And then they package it and send it to your home. Other online products that have become fairly familiar is the Amazon products of Amazon Go and Amazon Fresh, in terms of the robots picking up in the warehouses different items that you order and packaging those for distribution. The other thing is that we're getting new technology that is basically looks at your face and your voice. And this technology basically is also now being used to improve your online experience. So I hold my smartphone up to my face and it takes my picture, and then it starts to look at how I would look in these kinds of things. Mail order prescriptions have been something that have been around for a very long time. They definitely are convenient, but another thing that happened with the pandemic, which I see continuing, is retail pharmacies are now shipping meds through the mail. And I actually have one client who I am now getting notices on my cell phone that her meds are due to be reordered. And some of the technology that they are actually using is that it actually sends me a text and it says, she has taken so many pills, or she should have taken so many pills. Do you want me to reorder? And then I just hit yes or no. And then it'll send me a text a day or two later and says it's ready for pickup. And then I can call the pharmacy and I basically say, will you mail it to her? And I don't ever have to leave my desk, and she gets her medications. The software that pharmacies are using really are keeping track of the orders. They're keeping track of where the prescription is in terms of processing it, dispensing it, send a note that says, Here is the tracking number. It was delivered here. So it gives you all of the different steps. Telehealth is another thing that has come out of COVID in a really big way. It was making a pretty significant impact, if you will, on the delivery of healthcare services. But now both Medicare and Medicaid will be continuing to pay for telehealth services. And the benefit to like the primary care physicians and specialists is that they will be able to bill these services, whether it's an office visit or a telehealth visit, at pretty much the same amount. Medical offices and medical programs have been using a lot of telehealth as a way to screen patients and triage them to really figure out where they should, whether they should be seen in the emergency room, whether they need to have a call from the provider, whether they need to call in a prescription, whether they need to call 911. So that triage has been going on a lot over COVID, but was going on to some extent as well, especially with some of the nurse helplines. Call centers are also becoming more and more popular, where we're engaging more with high-risk patients with the goal of basically keeping them healthier, keeping them out of hospitals, and reducing their need to go into the into a care center or into the doctor's office. We're also finding that telehealth is a way that we can coach patients on their lifestyle. We can answer their questions. We can keep them basically in their own homes. Another kind of piece of this, which is not on here, is that we also have some agencies that are starting to make home visits. So groups like Dispatch Health and is now going national, and there are in various cities across the country, like doctors and nurse practitioners that make home visits. There are other physician groups that have evolved to do home visits as well as nursing home visits. So again, it's that bringing the healthcare provider to your home rather than always having the patient go into the doctor's office. Another thing that the telehealth stuff has done is it really has forced many people or allowed them to schedule their appointments online. The other thing that's really been a benefit from the provider's perspective is that if they are calling the client for a telehealth appointment, we are seeing fewer missed appointments because the individual will pick up the phone, or they'll pick up, they'll be available on their smart TV or whatever. Whereas if they had to catch a ride, they didn't feel like going today, whatever the excuse was, then they would have a missed appointment. Telehealth is also providing us a way to communicate with patients and providers through electronic records. Again, sometimes it's faster and quicker and easier to get a text. Where I get frustrated is if I'm getting a text or an email and I really want to talk to a live person. So sometimes I put into those records, please call me, because I really want to talk to somebody. Other things that can happen with the telehealth is that if you have some type of a screen, they can show you your x-rays and other kinds of lab tests or whatever. Also can show you like the results of an ultrasound. The other thing that has really happened over the last few years with telehealth is that now they can use certain kinds of technologies, look at something either in your house or when you are in the doctor's office, and you can get pretty quick readings from both major medical centers as well as specialists. and people find this very good as a user experience. So I don't have to go home and wait a week for my EKG results. I can get them much more quickly. Other things that our telehealth has really made a difference on is interventions by specialists to assist in healthcare delivery. So, for example, when my mother had her heart attack, she was taken to a small rural hospital in Western Kansas, and they were able to connect with a major medical center in South Dakota at the university. And they were able then to walk the local nurse practitioner through the process and steps of administering certain types of interventions right there in that very small rural hospital. Eventually, they did have to transfer her to a higher level of care, but at the local level, they were able to try to stabilize her. Another thing that I am totally amazed by is the new technology, or the technology associated with biosensors. So these are different types of sensors that you wear that monitor things like your pacemaker, your insulin pumps, and things like that. I have another client who has a pacemaker, and once a month or once a quarter, whatever it is, she has a little gadget that they have in her apartment. She puts her telephone receiver on that gadget, and they hook up the machine, and they're able then to monitor whether or not the pacemaker is working as it should be. She never has to leave her apartment, and it gives her the results that she's looking for. In the past year, based on the pandemic again, oral health has really advanced, if you will, in terms of their use of telemedicine or telehealth. So with basically you taking a picture with your phone again, they can get high resolution photos of your teeth and your gums and your mouth. And then they can take a look at that, they can do an assessment, and they can determine whether or not you need to be seen in person for dental services. Virtual consultations also are available even by phone if you don't have access to technology. Other things that can help, so in summary, getting a lot of your healthcare from your home is another way that you can continue to stay there. It also allows you then to have access to your healthcare providers without denying you care or reducing your access to care. Another type of service that sometimes is helpful, we frequently in our office will get calls for somebody who could help clean the house. And the two things that are most frequently requested at the very early stages of people knowing that they need more services are, I can no longer vacuum and I can no longer change my bed. I don't have a good answer for the change my bed from a technological solution, but there are now robotic vacuum cleaners and kitchen floor mops. I actually happen to have one of these vacuum cleaners, and I'm very satisfied with the service that it provides. You set it for the time you want it to come on, it comes on. The only maintenance really is that you have to empty the bin, but you can set it to clean once or twice a week. You can set it to clean at 6 in the morning or 5 in the afternoon. Similarly with the floor mops, it will mop your kitchen floor, and you then avoid having to do that. So another way for technology to be helpful. Transportation becomes a really big issue for a lot of our clients as well. These clients, as many of you know, are very reluctant to give up their car because it takes away a certain level of independence and being able to go when you want to go. The apps for Uber and Lyft, again, can be controlled from your cell phone or your smartphone. And the benefit of services like Uber and Lyft is that they usually have a very short window in terms of when they are able to come and pick you up. The other advantage that they have is that they will do what in the sort of transportation system that are funded through public programs like RTD or through the Title III programs, is that they will pretty much provide curbside service. So you go out to your front curb and your sidewalk, and they will drive right up to you. They do have a lot of built-in securities again. So you are going to know the license plate number. You're going to know the name of the person coming. They will know based on the app where you want to go. So there's very limited need to interact with the individual, reducing, again, the issues associated with fraud and or abuse. So it's another way to have pretty ready access to transportation without having to share rides, without having to be available and wait for long periods of time. And I do know, I've checked it out in some of the even more small rural communities, there are Uber and or Lyft services available. So it's not only a big city, if you will, service. Obviously, there's many more services available in large metropolitan areas, but I happen to know that it's also available in a couple of the rural communities in Western Kansas where my relatives live. So with that, that kind of closes our current presentation. So this is the next meeting and the link for that, which will be on home repairs. It is not posted on our website yet, but you can register directly through Zoom if you want to. Hopefully that will be on the website in the next day or two. This requires a pre-registration. You register for the webinar, and then it will send you the link for the Zoom. So we'll be looking at how do you provide services, how do you get home repairs taken care of if you want to live in your own home. So I'll look briefly here at the questions in the chat. And so
we do have a question, Eileen.
Okay.
Let's see, what about those with wheelchairs? This specifically came up when you were talking about Uber and Lyft.
I am not aware of any of the Uber and Lyft services having wheelchair accessibility if you need to stay in your wheelchair. I am aware that some drivers will help you put your wheelchair or your walker in the trunk of their car if you are able to transfer without your wheelchair.
And those are all the questions that we have.
Okay. So one question I see says, did you say a searchable database is at senioranswers.org? And the answer is yes. It is called a housing and home care locator. So feel free to check it out. And I see Maria put an answer in. So are there any other questions that we could share with you this afternoon? Okay, and as Maria has also pointed out, there's a copy of the slides will be sent out following this presentation. So thank you for your attention, and we look forward to having you join us in the future. If you have additional questions, feel free to give us a call. Have a good week and talk to you soon.